We're looking for evaluated ones. We were looking for evaluated ones so that we could demonstrate the impact. And we based our categorization of the interventions on the 5 areas of the Ottawa Charter for Health Promotion. So there's building healthy public policy, creating supportive environment, strengthening community action, building personal skills, and reorienting the health services. And we group them into the major theme for the programs. But it's important to note that health promotion is most effective when you use multiple strategies from the Ottawa Charter. And many of the programs that were submitted did use multiple strategies. And so while we've grouped them this way to present them, I don't want to in any way infer that these were like unidimensional programs. So we had examples of programs in building healthy public policy, tobacco, UVR and radar, creating supportive environments, bike lanes, community gardens, strengthening community action, such as walk-on programs for seniors or youth-led initiatives, particularly in school, developing personal skills, so awareness campaigns, resources, classes. And I will say developing personal skills is often where when people think of health promotion, that's often the area that they think of, but it's much broader than that. And then reorienting health services, and there were examples of a child health screening program for priority neighborhoods. All of these examples are outlined in more detail in the white paper, and I will put the link to the white paper in the chat once I'm finished presenting. So next slide, please. So Health Promotion Ontario is recommending maintaining the current breadth and scope of health promotion work as currently outlined in the Ontario Public Health Standards to ensure an ongoing investment in health promotion. As the currently, I think many people may on this meeting may be aware, but the Ontario Public Health Standards are being reviewed by the Office of the Chief Medical Officer of Health. And, with the success, well, if you can call it a success, the public health response to COVID, public health units have received a lot of attention for much of the work that we did in immunization and enforcement and disease prevention. But there's very little mention of health promotion, and health promotion was used across Ontario in health units to enhance health unit response, but it remains very silent. And so, and also we know that a lot of the things that are really cause the majority of morbidity and mortality in Ontario are chronic diseases. And so we want to make sure that that work of health promotion continues to be reflected in the standards. Health promotion is a well-researched, evidence-based, effective strategy that can really serve our communities well. So, thank you. I won't go into more detail than that, but I'm happy to answer questions. And as I said, I will put I'll pop the link to the white paper and the infographic in the chat. So happy to receive any questions or engage in a dialogue about health promotion, of which I'm passionate.
All right. Thank you so much, Susan. We'll give everybody a chance to put some questions in. And again, I will rely on Arlene to notify us if there are any questions or comments. But while we wait, thank you so much for such a comprehensive overview of the importance of health promotion. And hopefully this paper does have the impact needed when our policymakers are looking at those standards, and really hope they wanted to continue to put future investments in that upstream health approach. So thank you very much.
You're welcome.
Arlene, are you seeing any questions come through?
Not yet. We have a hello from the Peel Public Health School Health Team, and thank you for hosting this session. My apologies, I have so many windows open trying to watch chat and recording and so on. My apologies for not being as succinct as I'd hoped to be in terms of advancing the PowerPoint presentation.
So there is a question, I can read it. So it says, thanks so much for your efforts in putting this white paper together, or this paper together. Sorry if I missed this. How is this being shared with those at the ministry level doing the OPHS review?
So thank you for that question. So we have shared this report with the Office of the Chief Medical Officer of Health. We met with some staff, Heather Schramm, who's the Director of Policy and Planning. We shared this report in advance of releasing it. And then once we released it, we sent it, of course, to the ministry and also to the Office of the Chief Medical Officer of Health. We were invited to present and did present to the Public Health Leadership Table Chronic Disease Prevention Working Group. So we had an opportunity to share the paper at that level. And then, of course, we're sharing it with stakeholders or partners, sorry, I should say partners across the province, such as the Ontario Healthy Schools Coalition.
Yes, and we thank you for that. I also want to mention that we did send out a letter of advocacy for the continued standard to be in the Ontario Public Health Standards and or enhanced. So we sent that, we sent that to our membership, and hopefully people have received that and used that template to submit their own letters to the Ministry of Health and the Ministry of Education and or the Ministry of Education as they work together in this area. So of healthy schools anyway. I have a question, and that is, I was just wondering how you think that we can continue to be advocates for health promotion. Like, what are some of the efforts that you've seen worked in certain areas?
That's a very good question. I'm not sure I have all of the answers to that, but I think one of the things that we need to do is to continue to demonstrate the effectiveness of health promotion and speak to that. I think that it's easier to count things. For those of you who work in public health, and we have our accountability framework, and we have our annual service plan, everything is what you can count. How many immunizations did you give? How much vaccine did you waste? How many restaurants did you inspect? But when it comes to health promotion, there really isn't a lot of indicators that we can report on and report on consistently across the province. And so it becomes very difficult to make the case that health promotion is effective on a provincial level because we don't have a really good surveillance system in place. And so I think one of the things that we need to advocate for is a chronic disease prevention surveillance system. And I think for, schools, there has to be a surveillance system. And I know there's the Ontario Student Drug Use and Health Survey, but perhaps what we need to do is increase the sample size locally so that that information can really be used locally, because part of the problem is you don't have enough sample size locally. And so then you're always saying, this is the trend locally, it mirrors whatever happened at the provincial level. So I think that a robust surveillance system that has indicators that are proximal to the work of health promotion, I think is what we need. And I think we need to continue to make that case. But I also think we have lots of local examples of effective practice that we don't share. Like even writing the paper, it was hard to get examples from across the province. Because people have to go through whatever approval process they need to go through. So we need to get better at sharing our examples and maybe being a little less concerned about being perfect and being judged, and be more concerned about making a difference and helping other people make that same difference.
Thank you. That's great. Even I find stories are very, success stories are very influential for people to hear from the participants themselves or people that have noticed a difference. Sometimes those stories are very inspiring for people.
Yeah, I agree. Sometimes those are the ones that really impact and make a difference.
Thank you, Susan. Is there any other questions? Sorry.
No, that's okay. Doesn't look like it, Julie.
Not in the chat box.
No. Well, that was a great question. So, and it kind of ties well into our next section, which is our Healthy Schools Community of Practice. So this is a section as a means of generating some discussion and sharing some of those ideas. So we've prepared a couple of questions. So feel free to raise your hand or add an answer to the comments box, and Julie and Arlene will help facilitate some of those questions as they come in. So feel free to comment, like we were just discussing, on maybe how you are doing some health promotion in your schools and what that does look like. Or our first question here is, how do you create or maintain collaborative partnerships for the work of healthy schools? So I think this is a big part of the puzzle, and health promotion in our schools is really building up these partnerships. And something like this white paper is a really great tool in hand when presenting at things like school boards or local boards of health when trying to make programming changes and policies at a local level. So, you know, hopefully many of us can now use this paper going forward to help build these partnerships. But does anybody else have any thing they're doing well with partnerships between public health and school boards, or perhaps individual schools or different agencies within community?
And Courtney, before we get to that, my apologies. Sometimes it just takes a minute for the questions to pop up in the chat.
Okay.
But there is one other question for Susan, and perhaps this will give
excellent.
folks a minute, our participants today, to think about the question related to the question that you've just asked. Susan, if you don't mind, there is one more question. And the question reads, in the report, is there discussion about what health promotion looks like across different roles?
Across different roles in, sorry, could I get some clarity on different roles, like different roles in a public health unit versus a community health center, or different roles within a health unit?
Yes, if I can just scroll to, my computer's a little wonky today. You discussed not this being specific to health promoters, but how do we ensure that health promotion stays in the scope of people's work? So I think this is an important question before, as we move on and we think about that collaboration and collaborative partnerships in the work of healthy schools. So so to answer your question, it's as you discussed, not being specific to health promoters, but how do we ensure that health promotion stays in the scope of people's work?
So I think, you know, again, it goes down to demonstrating the value of health promotion. And so I think, you know, advocating for that. But I also think when you look at many of the issues that are before us, that public health often and schools often get asked to address, you know, like the opioid crisis, what's public health doing about it? I think that, you know, being able to share with, you know, the decision makers in your organization that is an appropriate role, and that people who work in health promotion are skilled in community coalition building, finding consensus, collective impact, and those are the strategies that we need for the future. It's not about education and telling people, you know, not to use drugs, or, you know, and I know that's an overly simplistic example, but it really comes to the nuance of working with partners. And I think if we want to make a difference on the health of our populations, these are the complex issues that we're going to have to tackle. And so I think health promotion is the skill set that's needed for those. I will also say, in my opinion, that when we look at some of the more clinical aspects of the work in public health units, I think absolutely they could be enhanced by health promotion, because I think that we can't treat our way out of anything, and that we need to start preventing things. And while, yes, we've got immunization and we can, you know, treat sexually transmitted infections, I think that we need to think more upscale, that eventually public health won't have the resources to treat the number of people that we treat in our communities. Our populations are expanding and our budgets are not. So I think that health promotion can really impact the efficiency and the effectiveness of the work that health units do in all areas. And so there's a business case. That's what I would go forward with.
Thank you. That's
awesome answer.
That's wonderful. Thank you. Thank you for answering that question. And thank you for taking your time to be with us today and your work in this white paper. Courtney, over to you as we lead into the discussion question. You've sort of set us up nicely for it in the presentation from Susan, and her work has nicely set us up for our next discussion point.
Excellent. Now, Arlene, I can't see the questions. Are there some there in the chat?
And just so that folks know, Courtney is working from her phone, and she had some technical challenges. So between her phone and my glitchy computer, we are working our way through the agenda today. There is, as best I can see, as best I can see, nothing in the group chat at this moment. And perhaps rephrase the question again, and we'll give folks time to think about their responses and their work.
Excellent. Now, also for the sake of everybody's time, I will be cognizant of the fact that it is 3:58, and I do believe we also have an update from OFIA, correct, Arlene? Do we have anybody from the ministry? Did they come on?
If you give me a minute, I'll take a look, and I'll let you know as we get closer to our update section.
Okay.
Hi, everybody. Sorry, I don't mean to interrupt. My video isn't working. My name is Molly Egerty. I'm a team lead with the Safe and Healthy Schools branch with the Ministry of Education. So if you are looking for ministry updates, we have nothing from the Ministry of Education, if that just helps clear your agenda.
Excellent. Thank you so much for hopping on.
No problem.
Okay. Well, that's great. So I will go ahead. There is a second question in our general discussion question here that we're going to try to phrase. And then if we don't get any questions or comments, then we will move on with our OFIA update. So the second question that we thought of was, how have you made intentional connections for comprehensive school health and mental health initiatives in your work? So looking at that comprehensive lens on our mental health initiatives, which we know is a big topic at hand during this school year. So I'll give everybody a moment if anybody wants to pop in and speak or add a comment to the comments section for the chat. Well, thank you, Marley. It looks like you've added the questions to the chat. That's great.
It's Amanda has her hand up.
Oh, excellent. Amanda, go ahead.
Hi, Courtney. Yeah, one of the things that we have done is really connect with the school board mental health lead. And so at the beginning of the school year, because they have a mental health and substance use action plan that they're required to have, we sit down with the school board mental health lead to go over the action plan to understand what initiatives they're doing, what they might need support with, what areas might be a gap that we could potentially fill. Is there anything that we're doing that might, complement or be like synergistic for some of the activities that they're doing? So that, I think, is really a really nice opportunity, because then we're also not duplicating any work or potentially interfering with some of the things that they're doing.
Excellent. Thank you for your answer. I think getting in with those school board mental health leads is definitely a #1 priority this year. Sometimes easier said than done, but that's excellent that you've been able to build that partnership, and also kind of connects to our first question there. And I apologize if anybody can hear a dog barking in my background. It is my puppy upstairs with my son. Thank you. Were there any other questions or comments or follow up to that comment? Julie or Arlene?
Sorry, the one other thing I'll just add to that is,
sure.
I believe it's a requirement for the school boards to have a substance use and mental health committee at their board, and they have community members and partners on that committee. So that's something I also sit on with the school board and other partners. So if you can get on to that, that is I think a valuable place to be as well. They also have student reps and parent reps on that committee.
Oh, excellent. That is great information for those health units who aren't on those at those tables. So to follow up with, thank you. Okay. I'm going to assume there's no other comments or questions, and we can go ahead and move on with our Healthy Schools update. So from OFIA today, we have Selena Churro, our Healthy School Certification Project Lead. Thank you, or welcome, Selena.
Thank you. Courtney, did you just want updates around Healthy School Certification or OFIA overall updates?
If you have something to share on one or the other or both, that would be wonderful.
Awesome. Yeah, so I am the Healthy School Certification Lead, so I have a quick update on registration, and then I also have a list of OFIA updates that other project leads have been working on and stuff that has been launched online. But yeah, so Healthy School Certification registration has officially closed, and overall we had 612 schools register this year. We're really happy with that number. We saw a significant jump in Ontario specifically. We have 498 schools that have registered for Healthy School Certification. Last year we had 430 schools. So we're really excited to see all the great initiatives that schools are going to implement towards their Healthy School Certification. And as always, if anyone here is supporting schools with Healthy School with the certification, if you ever have any questions, there is a contact us form on the healthyschools.ca website, or you can email directly at healthyschools@ofia.org or .net. I should double check that, but either it links through the healthyschools.ca contact us, and we encourage folks to ask questions around the 4-step process throughout the entire school year, because we're here to help and support. So that's an update from the Healthy School Certification. So OFIA has been busy, all the other project leads. So currently we have started once again the Draw the Line 16 Days of Activism Educator Series. So OFIA has partnered with various organizations for this educator series, and throughout the 16 Days of Activism Against Gender-Based Violence, which began November 25th, International Day for the Elimination of Violence Against Women, to December 10th, Human Rights Day. OFIA with our partner organizations will be providing various professional learning opportunities. One did take place, I believe yesterday, but there are 2 additional sessions that will be taking place, one in English and one in French. I will just pop those into the chat box here if you're interested in registering. Oh, the link won't go through. So maybe Arlene, I'll send you the links if you want to include those in the minutes or on the website. Sorry about that. Or I can do that at the very end. Another item I wanted to flag is jack.org's free mental health promotion for classrooms. So this eHub, Educator Hub, is a comprehensive free resource library that provides educators with teaching materials to bring jack.org's mental health promotion programming into their classroom. So the hub is designed for, was designed for and vetted by educators, including members of OFIA's team and our OFIA ambassadors. It's easy to use design allows teachers to expedite their lesson planning process, to pull together plans to meet the learning needs of their students. There is also some OFIA resources that you can purchase for yourself or your entire school board. So these include the activity count. So this is a series of 27 activity cards that introduce fundamental math concepts and skills to students in a fun and physical active way. So I'll provide a link afterwards if you're interested in learning more about the activity counts. There is also the Ready, Steady, Balance. So this is a series of 20 balance cards for elementary educators based on everyday movements and activities. And this provides students with a fun and meaningful way to practice stability skills every day in multiple environments. Also newly launched is OFIA's, in partnership with Gigi, Stop, Start, Consider, doing gender-friendly physical education in sport. So this is a free downloadable poster series available both in English and French. So it's developed to support school communities in creating identity-affirming, safer health and physical education learning environments for every student. So when students feel experience feelings of belonging at school, they're more likely to achieve full learning potential. So these posters are intended to be displayed in the classrooms and gymnasiums, staff rooms, main office, wherever you see fit, to start and consider, which intended to spark conversations about the important equity considerations, offering alternatives to potentially harmful practices, and promoting that inclusive learning environment within the classroom. So those are all the OFIA updates. I will definitely provide all the links to Arlene that can be shared amongst everyone here. Thank you.
Awesome. Thank you, as always, for the great updates and the resources that we'll share with the with everybody. Where are we here? Sorry. Okay, so I can see here on, if anybody has any questions, they can pop those in the chat or raise their hand. I'm just going to pop back. I can see the comments here now. We do have some other questions. We have Carly is wondering what that committee was called. I do believe I wrote it. It's Substance Use and Mental Health Committee. If somebody has something other than that, maybe you can jump on. We have Dee Vandenbroek. They participate in a similar strategy as Amanda. We have an ongoing subgroup, and our school board mental health leads and neighboring health units that support them to have regular check-ins throughout the school year and collaborate with opportunities arise. So this sounds like getting in with this mental health leads is really the best opportunity for supporting that comprehensive mental health approach. And then continues to comment that they have MOUs, memorandums of understanding, with their school boards to guide this collaboration. And again, I know many health units and school boards do have this, but not all. So hopefully, as we continue to work through the school year, we can continue to support each other in getting these signed.
I think,
we will include
Courtney, just to go along with that, that the Ontario Healthy School Coalition did have samples at one point of, and maybe Arlene can send that out with the notes, the minutes, or not minutes, but like some of the information from today's session is a link to sample MOUs.
Oh, excellent.
Yeah.
Yeah, that would be very helpful. So those can go out with our resources, our presentations, and any other links that come up for today.
Yeah.
So we have more thank yous for Ophia. Will Ophia be posting or sharing a list of schools that registered for certification? Do we have an answer for that? Will they be sharing this list, or do they share after the certifications are posted?
Yes.
Lena?
We typically share the list of schools that are certified afterwards.
Excellent. Excellent. I know I have a couple of schools participating for the first time, so they're really excited for this. So
yeah, if you are like a school board representative or a public health supporting multiple schools, you can get in touch and we can provide a list of schools that are registered, but unfortunately we won't be able to provide any contact information. So if you're just interested in which schools are registered within your school board, you can definitely do that if you use the Contact Us web form on healthyschools.ca. We can get that for you.
Awesome. Thank you so much. Okay, so if there are no other questions or comments, which it doesn't appear that there is, we're going to go ahead and wrap up. Some great comments, some great presentations and discussions for today. So thank you to everybody who joined and participated. Just a reminder that our next web meeting is February 22nd of 2024. The new year is upon us. And also that our conference is being planned and in the works for a tentative week of May the 27th. So mark it on your calendar. We're really excited about some potential partnerships for this one. So keep an eye out with an email with more details and how to register. Until then, the OHSC wishes you all the very best this holiday season, and nothing but health and good fortune for the new year. So take care, everyone.